10, 9, 8, 7, 6. Anxiety attacks can happen suddenly, like at the beginning of a speech, for instance. I, unlike most people, know I'm not crazy. I'm just experiencing anxiety. Along with extensive research on this topic, I have seen and helped a fair share of people get through their anxiety. Most of all of us have been through some sort of personal or social trigger that has brought on an anxiety attack. Today I will be going over why anxiety attacks happen, how to recognize them, and how to treat them. Dictionary.com defines anxiety as distress or uneasiness of mind caused by fear or danger or misfortune. A panic attack is a sudden surge of overwhelming anxiety and fear. Your heart pounds and you can't breathe. You may even feel like you're dying or going crazy. If left untreated, anxiety attacks can lead to anxiety disorder and other problems. They may even cause you to go through withdrawal from your normal life activities. Anxiety can be reduced with treatment, eliminated the symptoms, and regain control of your life very easily. The exact cause of anxiety is unknown. The tendency to have panic attacks run in families. They also appear to be a connection with other major life transactions, such as marriage, divorce, severe stress, such as death of a loved one, or a traumatic experience. Now let's talk about how anxiety attacks happen. I had my first anxiety attack about 1 year ago in the result of the death of my grandmother. I was driving home from work when suddenly I felt an intense wave of fear and discomfort. I became very dizzy and felt like I was going to throw up. My whole body was shaking, I couldn't catch my breath, and my heart was pounding out of my chest. I pulled over until the episode passed, but it left me deeply shaken. I had my next attack 3 weeks later after that one. They started occurring with increasing frequency. I never knew when or where I would suffer from an attack. I was afraid of having one in public. It got to the point where it controlled my life. I would only go to work and back home, where I spent majority of my time. I seek professional help and regain control of my life, and is now able to help others get through their attacks. If you know the signs of someone who is having a panic attack, you can recognize them anywhere. There are many common signs of someone having an anxiety attack. Melinda Smith states the most common symptoms are feeling nervous and having difficulty controlling worry. The victim may also experience sweating, hyperventilation, and an increased heart rate, and more. In severe cases, it can affect things such as sleep, thyroid, daily life problems, and your heart health. Now that we have recognized someone having an anxiety attack, let's discuss how to treat them. Although many anxiety attacks can be frightening, medicine and treatment is readily available. The first process is to try medication prescribed by your doctor. The most common type of medications prescribed can be antidepressants and anti-anxiety medication. Another form of treatment is cognitive behavior therapy, also known as CBT. In CBT, your therapist will gradually introduce the object or situation that triggers your attacks so that you gain the confidence needed to manage your stress and anxiety symptoms without any assistance. Now that you have learned the treatments for anxiety, let's recap everything we've learned today. Now, let's recap. Today we learned the basics about anxiety attacks. We learned about why anxiety happens, the symptoms to look for, and the treatments that can help who suffer from attacks. In conclusion, the biggest reason people suffer from anxiety is not knowing what it is. Hopefully, this has helped you recognize symptoms and help you or someone you know move forward to an anxiety-free future. Are there any questions? Thank you.